Hey everybody, this is Dr. Joe Borio with this week's Thought Flash. Quick reminder of what Thought Flash is. Thought Flash means that a term that BJ came up with, T-H-O-T, flash. If you read the green books, those were thought flashes where BJ felt as though he was directly connected, in the words of Einstein, a conduit to the universal intelligence, and those flashes of thought, those flashes of intelligence, those great ideas, you know, those days we get the light bulb over here, ding, 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 that's a thought flash. So that's what I try to think about, things that really portray chiropractic in its purest, vitalistic, philosophical basis, and those are the things I like to share with you guys every week. Quick reminder, we are going to be in Philadelphia. We're bringing in Dr. Tom Culton, functional neurologist, going to nail us with a lot of science. You guys get CE credits if you need them. I'm going to be there. Dr. Pete Lombardi is going to be there. Dr. Tom Culton is going to be there. It is going to be great. We're going to be right down in Philadelphia, and I would love to have more people join us. we're filling up right now. I would really be excited to have some new people, some new blood come to our events. I think you'll very much be pleased with what you see and what you experience, and you'll realize that, hey, we're the real deal. I still practice during the week, and I still love what I do, and I want to share that with some level of enthusiasm. I want you guys to have some increased degree of certainty and some science and some technique, and then you coach with me if you feel as though it's a good fit. And I'll tell you what, I think it'll make some massive changes in your practice. It is our day for chiropractic. It is our time, and I want to be part of that wave. I want to be part of that movement, and I think in becoming a consultant and a coach, I think I will be, and it's enjoyable, and it's great to see these new people, whether they've been practicing for 30 or 40 years or whether they just open a practice, join up with us and turn the lights on for them and really watch them start to implement what we teach them and how it changes their life. It's just unbelievable. Today I wanted to talk about head in the game. What the heck does that mean, head in the game? You know, my coach used to say that when I played football or lacrosse, or I used to wrestle. I used to be a professional fighter, and you know, all of that stuff. Every coach I heard, and certainly me being your coach today, is head in the game. And what head in the game means is, we always talk about rituals, but the rituals allow you to get your head in the game. The head in the game means you got to be thinking about what the heck you're doing, and that means intention and objective. What is your thought? What do you intend to perform? What do you intend the result to be with an interaction in your office? And you can take it at any level, in an interaction with your staff, an interaction with the members of your practice, an interaction with a non-member of your practice. Everything should have some intention, some objective. And I don't mean an agenda and a manipulation, but I mean an intention, and that comes from your purpose, that comes from your mission. So what is your mission? Well, your mission is to help people. That's going to be derived from your purpose. Hey, my purpose is, as a chiropractor, is that I want to serve people to allow their nervous system to properly communicate from brain to body. I want their innate to flow. I want their body to function exactly the way nature was intended, and by adjusting the spine, I want to remove as much interference as I can to allow innate to flow and to keep the spine healthy. I want good spinal hygiene so these people have really healthy spines as they go through their life. For the young children who come in, I want them never to get the sickness and diseases and the shifts and the abnormal spinal curvatures and the basic distortions and postural distortions as we learn about. Boy, you sit in through a couple of CBP seminars, you look how distorted and sick our spines are. So I never want those to happen. And for older people who come in, I want to get their spine as functionally normal as we can, or closer, or improve upon neurologic function and mechanical function as best as we can. And then I want to maintain that with really good wellness care, frequent wellness care, to ensure that their spine doesn't deteriorate anymore, or certainly slow it down significantly because they're older and their spine is so sick and diseased. And then what do you need for justification of that? Just look at the CBP, and you look at JMPT, and you look at the Journal of Vertebral Subluxation Research, and you start to look at all this stuff mechanically, and you start to look at it neurologically, and you realize, boy, there is nobody that does what we do. See, I really believe, and it's unfortunate that the profession doesn't look at this as a whole, but I really believe, why in the world would any of us want to treat back pain? I mean, it's so ordinary, it's so boring, it's so small. I always say that we invented a computer and we want to play Atari on it rather than stepping back and really looking at what that computer can do. My God, the mathematical equations it can computate and how phenomenally efficient it is for photographs and email and everything. My God, you can do everything on an iPad or an iPhone or on a smartphone, any of these things. And we as chiropractors want to go in and crack somebody's back so their back doesn't hurt, when we don't realize that, hey, the reason their back hurts in the first place is why. Their back hurts because that's their neurologic system saying, hey, rather than an idiot light, right? I mean, I remember heard Reggie Gold say, I'd like to have a red light right on somebody's forehead and say tilt when they're subluxated. I mean, that'd be great. Or lights on the back and say, hey, I'm subluxated here. Let me adjust that by a chiropractor. I mean, that'd be great, but that isn't the case. So how does it let you know? It lets you know by having pain. But there's a lot of sickness and disease and illness before the pain even begins, right? You need 40 to 70%. You can block an artery in your heart by 70, 80, 90% before you ever have a heart attack. So how much sickness, disease, and illness is in the spine before they even hurt? So their condition started years ago. So head in the game means that's what I want you to be thinking. When you walk into a room and address a person, you should be thinking about what it is you're trying to complete. What is your objective based upon your intention? What is it that I'm trying to make happen here? And you can do it on all different levels. Certainly you want to adjust them to remove interference, allow their spine to start moving in better alignment. Maybe it's a wellness patient. You want to check them and make sure it hasn't shifted back out. You want to make sure that the spine stays healthy and functional. Right? That's one angle. The other one would be what? Hey, I want them to know that what I do is valuable. Hey, listen, Bob, I'll let them know when they lay down there. Don't just start talking about the weather, adjust them and pat them on the back or their fanny and let them go. Let them know, hey, listen, Bob, this hip's higher and I'm going to adjust you. Now that area goes to the large intestine, the pancreas, the gallbladder, my liver, my kidney, whatever, and by adjusting it, Bob, you're going to have better nerve function and that body part's going to be working a lot better and you're going to be healthier this week and I'm going to see you on Wednesday and I can't wait and I'm already looking forward to it. I mean, that's how you have to be talking to people. I mean, my talk this week, my table talk is I adjust them, Bob, that goes to the pancreas. So you know what I can hear right now? I can honestly hear your nerves working faster right now. Can you hear it? And you do fun things like that. Bob, that's the sound of you getting healthier. Bob, that's the sound of me getting healthier. Bob, I just adjusted you. That adjustment was so good, I feel better and I didn't even have a subluxation there. I mean, make it fun, but also there's an objective and an intention there. I want them to see value and enjoy the adjustment. I want them to enjoy it. I want the experience to be a good one, but I want it to be a valuable one. I want them to walk away from that adjustment and say, wow, look, I got a great adjustment. I understand why I'm there. My nervous system's working better, or my spine's working better, or it's in better alignment, which means I'm healthier, and so forth. Hey, listen, a healthier spine means you're healthier, right? We've always heard those terms like an optimum spine equals optimal health. That's a good term, but I really don't think people understand it. Optimum spine, optimal health. I think it's a little bit beyond what the average person is thinking. Bob, if your spine's shifted or crooked, your nerves can't work as well and you're sicker. People understand that. That's simple. It's not catchy. It's not phrasy. It's not salesy. It's really, bread and butter, if you will, chiropractic. And that's the way we need to talk to people. I don't care if they're professors or if there's somebody that turns wrenches. I mean, you got to speak in terms that they understand. So my intention, my objective, my head in the game when I walk into a room is I want to let them know that something shifted, that there's value to, or I'm going to adjust it and correct it, and there's value to it based upon where I adjust them, and that those areas go to certain nerves. And when I'm done with that, I want to try to confirm that appointment. I can't say that I do that every day with like my 3-time-a-week patients or even some of my twice-a-week patients, but certainly my once-a-weekers or my new members of the practice or people that are coming in every other week or less. I certainly confirm it on those visits. Really, really important. Bob, I'm going to see you Wednesday on the 8th. I'm going to see you in 3,000 miles. I'll see you in that adjustment's going to last you 3,000 miles. That adjustment's going to last you 72 hours. And then when you get back in, we're going to realign that again, make sure those nerves are working the way they're supposed to. Hey, Bob, that shift right there is genetic. And a lot of times you'll pass it right on to your kids. It's really important. Hey, Bob, you know what? That shift in your spine is crooked based upon how you walk and so forth. And you'll find that people around you tend to walk the same way, and that would be your kids. It's going to be important to get your kids in here. Ask them, hey, who needs chiropractic care? Everyone. Are you just saying that because you know that's what I want to hear? You really believe it? I really believe it. Well, look, I don't mean to put you on the spot, but your kids aren't in here yet. Tell me what we can do to get them in. I mean, that's what I'm talking about. Head in the game. Listen, I'm there not to get through the day. I'm there to make a difference during the day. I'm there to make a difference during the day. I'm there to change the world one adjustment at a time. I realize that I can't adjust everyone physically, but I'm there to change the world one adjustment at a time. And you will change the world by that one adjustment. I know you don't see it, but if you read the greatest minds that have ever existed in spirituality and physics and metaphysics and so forth, what you say, what you do changes the world a little bit every time. And I think if you think about it that way, you'll realize how important your time is. And that means what? You got to get your head in the game. Going right back to what I was talking about. Guys, it is always an honor and it's a pleasure. I really hope to see you in Philadelphia on May 13th and 14th. I'm telling you, we're trying to change the world. I'd love to have you be part of it. Jump on that, on our wave, our tidal wave, and make some changes in this profession. Let's make chiropractic what it should be, the premier wellness health choice now. Now, this generation. Let's make it happen now. Guys, remember to enjoy the people you serve. Treat everybody precious. Make your adjustment important. Make your adjustment have an intention and an objective. Talk vitalism. Enjoy your staff, enjoy your friends, enjoy your family. Have a great week. Serve. Have fun with chiropractic. I'll talk to you guys next week.
My best friend gave me the best advice. He said each day